With the diagnosis of and the treatment of childhood cancer come many challenges for the entire family. The Hope and Cope Psychosocial and Education Program at the Alabama Center for Childhood Cancer and Blood Disorders provides support and services from diagnosis onwards using a family-centered approach. To ease the stress and distress, expressive activities are provided that promotes emotional well-being and quality of life, not only for children who have been diagnosed with various cancers and brain tumors, but for their families as well. There is growing research evidence supporting the benefits of these expressive activities when used in combination with conventional medical treatment to strengthen resilience and enhance a child's emotional health and well-being. A favorite activity among the children is the Drumming Rhythm Circle, made possible by the generosity of the Austin Hatcher Foundation, who have proven to be faithful and committed partners.
We have had drumming made available to our families on our inpatient unit for several years now, and it has had such a profound impact. The kids just get into it. Sometimes they just want to listen. Sometimes they want to participate. This is an activity that really allows you to process your feelings and think about everything that's going on inside and express it through hitting on the drums if you're really mad, or kind of just working it calmly through, or whatever you want. The rhythm kind of sets the tone for what you're feeling.
Facilitating the drum therapy program is Walker Wright, who spends 3 days a week on the unit engaging the patients in therapeutic drumming, either one-on-one or as part of a group drum circle.
We utilize rhythm and drumming as a therapeutic tool to work with all age groups on the floor, 8 months all the way up to 23 years of age. We use everything from shakers to smaller frame drums to bigger djembes and congas as a therapeutic tool to help these kids to express, to create, to set an atmosphere of rest and relaxation, and hopefully a stress management tool for not only the patient but also the family. I work very close with the child life specialist. As I come in too, we sit down and meet, and we're able to discuss what patients are on the floor, what issues might be happening on the floor, who is the focus, who are the most important kids to see for that day, and if they are dealing through anger issues, or if there's a brand new patient who's not engaging, or if it's a time of celebration where the family has received great news and we want to celebrate.
Studies have shown that expressive therapies in a hospital setting, such as drumming, provide a real and profound benefit to the healing process.
This is more than just a simple diversionary activity. This definitely has impact on how a child's mood is, if they're in pain. It really can transport you to another place and help you process and deal with these issues that might be very difficult to express verbally, or something you don't want to talk about.
Walker certainly has a way of getting these children to connect with him, even when others can't. It's not difficult to see the special bond that he's developed between him and so many of these courageous kids.
I met Walker before here at camp. I met Walker. He came and he did a drum circle. So when I found out that Walker was the one teaching drums, I was pretty excited.
It's an absolute honor to work with these kids. Their resiliency is just incredible. Just looking at each of their stories, whether it was Clara, a 4-year-old little girl that's recently diagnosed, just the privilege of getting to know her family and working directly with her. It's amazing to look at a little girl who is just so resilient and so strong, and to see how an activity like this can brighten her day. To working with Randy, age 6, a Latin American child whose family actually doesn't fully speak English, and that's been a fascinating aspect of working with the families, is just seeing how rhythm and drumming can bypass all obstacles. They don't understand me, I certainly don't understand them, but the camaraderie and the community that we build through making music together through rhythm and drumming is amazing. Certainly such an inspiration to me. And then stepping in with Colby, a beautiful 10-year-old little boy with special needs, and seeing how music can impact a child like Colby is amazing. As a matter of fact, I just left a drum with him yesterday because he wouldn't stop playing it. And Levi, for a teenager that's such a special kid that loves creating music, something he really enjoys, expressing his own rhythm and having the freedom and no fear in making the rhythms that he wants to make. So we're able to communicate through that. All I can do is sit back and say thank you to the Austin Hatcher Foundation and Children's of Alabama, just because I certainly don't feel worthy to be doing all this. So it's a blessing.
On behalf of the families, the staff, the faculty, and everyone here at the Alabama Center for Childhood Cancer and Blood Disorders, a big thank you to Austin Hatcher Foundation. This would not be possible without you. You truly make a difference in the lives of the children that we serve.
Thank you, Austin Hatcher Foundation.